Welcome to this last installment regarding the peritoneal dialysis, and today we're going to talk about peritoneal equilibration test. Now, the PET test, as it's commonly known, is a test that's unique to those patients who do peritoneal dialysis. And to understand why that is the case, we have to make a little comparison between PD and what we've taught you about peritoneal dialysis thus far, and HD, and what we've taught you about HD thus far. So let's look at hemodialysis for a minute. I'm going to draw in some familiar arrows. These are things that you've seen in previous tutorials. This is the blood. And of course we have dialysate as well, which I'm going to draw as yellow, going in the opposite direction of blood. Now, what's unique about hemodialysis is that you have a fresh supply of dialysate entering into the filter every minute. And that fresh amount of dialysate allows you to remove or clear solutes at a maximum rate, because you always have the maximum amount of concentration gradient. It really doesn't matter what the concentration of any solute is at this point or this point or this point, because you know that that section of blood, that portion of blood, will come in contact with dialysate that has zero concentration of that toxin, of that poison. So in hemodialysis, you don't have to worry about a hemodialysis equilibration test, because you always supply fresh dialysis on a minute-by-minute basis to the chamber, to the filter, and therefore your blood is almost always exposed or coming in contact with dialysate that has the least concentration of poison, namely 0. That is not the case with peritoneal dialysis. In peritoneal dialysis, you infuse some dialysate into the abdomen and you let it sit there. And it has to sit there because if you were changing dialysate minute by minute, this would be an untenable form of dialysis for any patient. So you have to let the dialysis sit here. But you know that as you let dialysis percolate in the peritoneal space, you're going to have a diminished rate of solute clearance. So I'm going to denote solute clearance here in the pink color. So you have solutes coming out, some by diffusion and some by convection, but the concentration of those solutes in the dialysate increases as time elapses. At one point, at a specific point in time, you're going to have very limited movement of solutes from the patient to the dialysate, because the concentration gradient will no longer favor movement. So what you want to know is, at what time do you no longer get movement of solutes from the patient to the dialysate? Because it's at that time you're going to change the dialysate and introduce fresh dialysate into the peritoneal space. So to do that, you perform the peritoneal equilibration test. So what is that? It works on the concept that we just talked about. The concentration of a solute, X, in the dialysate, that's here, over the concentration of that solute, X, in the plasma, and that's here. Well, at time 0, let's get a little bit more space. All right, at time 0, so we're going to say time 0, this is 0, because there is no concentration of X, whatever that poison happens to be, in the dialysate. And as we move along, 1 hour, 2 hours, and 4 hours, we get different concentrations, different ratios of dx over px. And so we measure these concentrations and we calculate this ratio. We know that solute clearance will eventually stop when the concentration of dx is equal to the concentration of px. In other words, when the two concentrations on either side of this peritoneal membrane are equal to each other, or when the ratio equals 1, solute clearance will stop. So we're trying to figure out what time does this happen. And at that time, you're going to change your dialysate to a fresh sample. So this time is different for different patients because patients have different characteristics of their peritoneal membrane. So whenever a patient starts out on PD, you will very soon perform a PET, peritoneal equilibration test, to determine how long the dialysate should sit in the abdomen before you change it and introduce fresh dialysate. But even within a patient, you can have changes to the peritoneal membrane because patients age, or patients have recurrent peritonitis infections, or patients have been exposed to so much dialysate, meaning they've been on PD for so many years. The peritoneal membrane can change as time elapses. So if you don't get the type of dialysis you were initially expecting, you're not getting the type of clearance that you expected, you're not removing as much fluid as you expected, or you have a PD altering event like peritonitis, for example, you'd perform another PET. And so PETs are performed on patients who first start peritoneal dialysis, but they're also performed on the same patients as time elapses if there's any kind of dialysis altering event that has occurred, or if you as a physician are not getting the type of clearance that you initially expected you were initially receiving. Now, what is X? We haven't defined that. So X is the concentration of solute, and historically, or by convection, we say X is the concentration of creatinine or the concentration of urea. And most dialysis units will measure both. So you measure the concentration of creatinine in the dialysate and in the plasma. At time 0, that's 0. And then you measure the concentration of either one of these, or both, at 1 hour, at 2 hours, maybe 3 hours, and at 4 hours. You'll get a nice idea of when you're going to reach equilibrium, and at that time period, you change to a new bag of dialysate. And that's generally how the peritoneal equilibration test works. Thank you very much.